Hello, it's Dr. Luke Macaron here, narrating an edited video of cataract surgery. So at the start of the operation you can see a small incision is made, and then with this cannula a clear material is injected into the eye. This is viscoelastic, which maintains space in the eye to allow the surgery to be performed. This is the creation of the main wound with a sharp instrument called a microkeratome, which is about 2.75 millimeters wide. At this point in the operation then, a small round window needs to be created in the front of the cataract, in the front layer, which is called the capsule. It's a very delicate, fine, clear layer which is only about 15 micrometers thick. So it's difficult to see, but the fine forceps are dragging around a small tear in the capsule to create a round window. That allows access to the inside of the cataract. This is the main instrument which breaks up the cataract, a phacoemulsifying probe. It's a high-frequency ultrasound probe which is used to groove the dense nucleus of the cataract, which can then be broken up into smaller pieces. This is a second instrument, so both hands are being used. They're placed down into the groove in the cataract, and then that groove is dragged wider so that the cataract is actually split into two halves. It can then be rotated, as you can see, and then another groove is made, and the two instruments again are used to divide up the nucleus of the cataract into smaller pieces. Once the nucleus is divided up into smaller pieces, they can then be emulsified or essentially liquefied by the ultrasound, and then that is sucked up into the probe and removed from the eye. Once the dense nucleus is removed, at this point this special instrument is used to actually remove the cortex, which lines the inside of the capsule of the lens. At this point then, all that's left once the cortex is removed is the original capsule of the lens or cataract. At that point then, the intraocular lens implant can be injected into the eye. You can see it here, gently unfolding and being positioned with this finer instrument into the capsule of the lens. At that point then, the viscoelastic is removed, it's sucked out, and at the end of the operation here some injections such as antibiotics and steroids are applied.